As we mentioned earlier, Chicago Public Schools says it will lift its mask mandate next week. The district announced the move to a mask-optional model today, citing a significant decrease in COVID metrics, improved COVID testing in schools, and a rise in vaccinations in the district. But the Chicago Teachers Union is pushing back, saying the decision violates a safety agreement made in January. And joining us to discuss the decision are Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health, and Pedro Martinez, the CEO of Chicago Public Schools. Welcome both of you back to Chicago tonight. Pedro Martinez, I'll start with you. Why this decision to make masks optional starting next week?
Well, Paris, it's been almost 2 years since the pandemic started hitting our schools, and this is the first time in those 2 years that I've seen at the national level with the CDC, at the state level with IDPH, and at the local level with our local Department of Health, where all three are saying we're now in a low-risk environment. So after consulting with medical professionals, with Dr. Arwady, we decided that it is time now for our district to go mask optional. We were one of the first districts that went universal masking, and we're one of the last districts that's now going mask optional. And I think I'm just encouraged by where we're at with the safety conditions.
Dr. Arwady, despite this, WBEZ analysis found that nearly 3/4 of all public schools had a less than half, a 50% vaccination rate. Some schools on the south and west sides, vaccination rates are in the teens and 20s. So why a one-size-fits-all mask policy given the variance here?
Yeah, so no doubt that we need to continue working on vaccination, but at the district level, 56% of CPS students have had at least that first dose, 49% are fully vaccinated. Those are the kinds of numbers that we look at when we make decisions at a district. And look, we're going to continue to encourage, if folks are not vaccinated, that they can choose to continue masking. But the bottom line is we are in a good place here in Chicago. And when we're in a good place from a COVID perspective in the community, it also means we're in a good place in the schools where we know that the risk is actually lower than it is in the surrounding community because of all the other mitigations that are in place.
And as you both know, the Chicago Teachers Union is not happy with this decision. In a statement released today, the Teachers Union pushed back, saying, quote, "The decision by Mayor Lori Lightfoot and her Chicago Public Schools team to unilaterally remove the mask mandate starting March 14th is a clear violation of our January 12th Memorandum of Agreement." Pedro Martinez, is this a violation of that agreement?
Well, Paris, we've been talking to our CTU partners really over the last couple of weeks as we were seeing both the safety, both the measures getting better and just telling us that it's much more safer. And one of the things I also want to clarify is Dr. Arwady said, we're still going to continue to encourage masking, especially in communities that have many children that are unvaccinated. And so I feel confident that we're going to continue to talk to our partners. We'll come to some agreement. But I do feel I'm hopeful. I'm hopeful that we're now safe, and we just have to continue to double down on vaccination efforts in some of our neighborhoods so that we stay safe.
And Pedro Martinez, you mentioned you talked to some folks in the CTU. Did you talk to Jesse Sharkey? Did they seem to be on board with this announcement, or did they push back?
Well, we've been talking to not only Jesse, but the team in general. My team has also been talking, and so we were just having conversations about how do we make sure that. First of all, we might have some staff that might have some health conditions, some of our children. How do we make sure we protect them? How do we make sure we continue to encourage masking in environments where we know that there's still some risk? And so those are the discussions we've been having. And again, we're going to continue to have those conversations. I just believe right now, we've always said we're going to listen to the science. I'm going to listen to our medical experts, including Dr. Arwady. And I think, like I said, I'm hopeful that this is the safest that I've seen our community be.
Dr. Arwady, what about teachers and students that have medical vulnerabilities? Should there be a mask policy, maybe a different option for a mask mandate for certain classrooms?
Yeah, so as you know, CPS has made available not just masks, but the best quality masks out there for kids and adults who choose to continue to wear them to protect themselves. And I want to be clear that it's not like masks are going to vanish overnight. Masks will continue to be required, for example, after students or staff have been home for 5 days of isolation or quarantine. To come back, they'll have to continue wearing them in days 6 through 10. If we have any concerns for spread or we're investigating, a potential cluster, we will be asking and really even requiring in those limited settings some masking. But the good news is, by every metric, old CDC metrics, new CDC metrics, every measure that you count here, we're at 0.8% positivity as a city, and CPS's screening positivity is at 0.14%. That is absolutely a place where the risks remain low. We need folks to stay out. If they're having symptoms, we need to keep the testing up. We're not done with COVID, but we are at a point where we can lift this requirement for everybody while continuing where people choose to continue to wear that, especially if they're unvaccinated. I want to be really clear that that is absolutely not only acceptable, but it's encouraged.
And Pedro Martinez, the union, as we mentioned, in their agreement said that the masks should remain up until August. They're going to file an unfair labor practice charge. Your response to that?
Well, like I said, Paris, we've said that we're committed to safety and we're committed to following the science. And right now, when you look at, where we're at with our positivity rate, how low our cases are, the fact that we're doing more COVID testing than ever before, our safety procedures have never been stronger. And here's what I believe, Paris: the majority of our schools, because when I go visit classrooms, we never see any challenges with masking. I think the majority of our children are still going to wear masks. And we're actually going to be providing lesson plans to our teachers to just have those conversations with children so that, we're very accepting whether a child's wearing a mask or not. And we also want to make sure parents understand the risks. So if you're not vaccinated, they just have to know the risks if they're not masking. So I believe, most of our schools will continue to mask. We're going to double down on vaccination efforts with our mobile events. The Dr. Awadi has an amazing program where they actually go to your home to get vaccinated. So my message to our families: please get vaccinated. Let's keep our community safe.
That labor agreement, Pedro Martinez, came after 5 days where teachers and administrators had walked off the job. Can you provide assurance for parents here that a work stoppage like that is not going to happen again?
I'm going to be an optimist, Paris, that I think the majority of our staff are also feeling good about where our city is at and where our district is at. Because the data is very clear and our keys are very clear. We're very transparent. And so, again, we're going to continue to work with our CTU partners. We'll continue to, wherever there's anxiety, as Dr. Awadi said, we will have masks in every single school. We'll have them available through the end of the year, KN95 masks for both children and staff. So I think we can work through this, and I'm looking forward to it.
And Pedro, as you know, there's a lawsuit brought by a downstate Republican who's now running for a political office. A judge is set to hear this case very soon. Is this decision influenced by that case?
Well, the first driver for us always is safety and where the health metrics are at and what our medical professionals are saying. But I will tell you, Paris, we wanted to make sure we also retained our ability to pivot if this pandemic changes, because we've seen it change multiple times. And so it was very important for us to continue to keep our authority. So that did weigh into the decision, but the priority still will always be safety and where the health metrics are at.
All right, we're going to have to leave it there, and we thank you both for joining us. Our thanks to Dr. Allison Arwady and Pedro Martinez. Thanks so much.
Thank you.
Thank you for having us.
And on a programming note, a member of the Chicago Teachers Union leadership will join us tomorrow night.